You're watching CTOM TV. Knowledge is power.
Hello, my name is Michelle Morand. I'm a co-founder of Cancer Treatment Options and Management and have 30 years experience in the mental health, addictions, and recovery field. For the last 10 years, I've been working in the field of precision oncology, helping cancer patients and their oncologists access leading-edge medical science treatment through public or standard care providers. The reason I'm here today is I want to share with you a little presentation that I made about COVID-19, talking with you about best practices. Some of the sites that I've come across as I've been researching for our cancer patients who, of course, have extra concern about how COVID-19 and what's happening with the worldwide pandemic might affect their access to cancer care, or just might affect them as cancer patients with reduced immune system function. And it occurred to me that the information that I was sharing with our patients would be very advantageous for you as well, because the sites and databases that I'm encouraging our cancer patients to review are all really well-reputed sites that you would benefit from being able to review if you're trying to keep up on what the latest science says about COVID-19. So I'll try to keep this brief for you. I'm sure you have lots to do and you're probably a little inundated with all the COVID-19 news. So we're going to be as brief as we can here so that I can share things with you like ibuprofen, do or don't, best practices for social distancing, for grocery shopping, for takeout, and numerous other things that are important for you to know. What I'm going to do right now is just share my screen with you, and we're going to look at a little bit of a PowerPoint here, and then we're going to scooch onto the internet, and we're going to have a look at what some of these great sites are telling us about what's happening in the world right now. So first things first, good news. A recent study that I saw today in the Washington Post. It's behind a paywall, otherwise I'd have the link for you, but I'm sure you can Google and have a snoop for yourself. But what they're ultimately saying, the best news is, so far it appears that coronavirus is not mutating very rapidly. What that means is that it's going to be very probable that we'll be able to fairly rapidly develop an effective vaccine. There was some concern that perhaps it was rapidly mutating and that a vaccine would be very hard to come by. In their own words, here's the science speak, it's not mutating significantly as it circulates through the human population, according to scientists who are closely studying the novel pathogen's genetic code. That relative stability suggests that the virus is less likely to become more dangerous as it spreads, and it represents encouraging news for researchers hoping to create a long-lasting vaccine. That's good news. How can you avoid getting COVID-19? Well, we've been told, wash your hands and face regularly, especially if you're going out and interacting with other people or out in the world, even if there's no one standing right next to you right now. If you're out of your house, presume someone was just there. You just missed them and they just touched that very thing that you're about to touch. Assume that. Err on the side of safety. Also, if you have any symptoms whatsoever, remember a large percentage of the population are relatively asymptomatic. They might feel a little headachy, they might feel a little sniffly, a little tired, but they don't necessarily exhibit the major symptoms that we're most concerned of. So you might have COVID-19 and not know. Let's presume that you do. Sneeze or cough into your elbow or a tissue, and make sure you practice good social distancing. This is the image that I like because we all have a llama. We all know how sweet llamas are, and we really want to keep a llama distance between us and the person in front of us when we're out in the world or engaging with people, no matter how much we love them. Even if they're family members, if they don't live with you, you want to keep that llama distance between you. Unless you really are prepared to get COVID-19. That's really the choice you have to make. We're not being extreme here. You can see how rapidly this virus has spread around the planet and in your country, wherever you live. So best practices, 6 feet. Social distancing really means reducing close contact between people to slow the spread of infectious diseases. In countries that have practiced good social distancing, we see that their disease curve, the number of infected, is far lower than a country, say, in the United States, which took a little bit longer to get there. I'm going to show you a map that shows you what's happening around the world, and we'll see the numbers and the statistics in just a few minutes. Why we want to practice social distancing is because, you know, in general, normal times without a worldwide pandemic, most of our medical systems are fairly taxed already. That's just a reality, is that there's not a lot of money in the medical system, and there's a lot of people who need care. So if you think about now adding thousands of people who need emergency medical assistance to those of us who might have a heart attack or a stroke or break an arm or have a car accident or some unfortunate event and normally need the medical system, you begin to understand why keeping yourself healthy on all levels, but especially reducing the likelihood that you get COVID-19 or share it with someone else is so important, because it's not just those with COVID-19 who are going to be needing the medical system. It's all of us who normally would for other reasons anyway. And that's why things get so overloaded and so dangerous. You're probably all tuned into social distancing, but we really want to avoid gatherings really right now. Many countries are saying of more than 2 people. I know my family went grocery shopping today, and only one family member was allowed in the store, which was really a great idea. I'm in full support of this. And the pet store in the town where I live, only one shopper is allowed in the store at a time. You're not allowed to touch anything. The store clerk puts all the things you want in the basket, rings them up for you, and you really don't touch anything in the store at all except maybe that keypad if you're paying with your debit card or your credit card, which immediately gets wiped down and out you go. So many shops are practicing these kind of techniques, those ones that are essential services and need to stay around, like grocery stores, pharmacies, and others. So try to avoid any of these public events. Again, even when you're out walking, if it's a relatively public area, even if there's no one around, I want you to imagine that somebody was just there, you just missed them, and they just touched this very thing, and they have COVID-19, and you're going to be careful. When you go to grocery stores, take out food, pick up medication, receive or make deliveries, or use a gas station, you want to, as appropriate, you want to keep that distance between you and others. Ideally, you wear some disposable gloves, you use some Lysol wipes, some antiseptic sprays, and you make sure that you wash your hands for that good 20 seconds with soapy water as soon as you can. Don't touch your face. Safe to do things, all sorts of stuff at home, of course. Don't have friends or family over, no matter how much you love them. Really, just connect online, connect through the door. You just don't want to take that risk of being one of those people to spread this disease and cause someone else harm. Now, I want to switch now to sharing. I'm just going to move on here. Hang on a second, because I do want to share with you this series of websites. Where did they go? Okay, just gonna close that down here. So let's see here, go to Johns Hopkins. This is the, let's see, we wanna go total confirmed. Maybe you've seen this little map here. There's a few of these around the world right now, but this is the first one I came across weeks ago, and Johns Hopkins is such a reputable source, so I encourage you to have a look at this one. What you see on this site, if you haven't seen sites like it before, is on the left-hand side in red, you see the total confirmed cases of people infected with COVID-19 around the world. You also can see by scrolling through here, the numbers per country. I'm in Canada. We have 4,682 as of now, which is March 27th. The United States, just beneath us, has 101.5 thousand, which is surpassing Italy and China very rapidly. Their curve is pretty high right now. We have countries like South Korea who started out with a very steep curve, but because they had experienced 2 pandemics in about the last 10 years, they had a very rapid response. They knew what to do. They did everything right. And so they've really managed to keep the spread of the disease, the virus, to a minimum. If we go back over here, let me just refresh again. What we're seeing on the right-hand side is 2 categories. In white, as you can see, the number of people who have died from COVID-19 worldwide, and in green, the numbers who are recovered. The variance between the total confirmed and total deaths at this time is about 4%. So in terms of what we were told when this pandemic first began, which was about 3.65 to 5-ish% of people who contracted the virus would die, again, number of total confirmed deaths is at 4%. So that's so far the scientists have been pretty bang on. Another site that I want you to know about if you're in Canada is this site by the Government of Canada. I have a PDF for you, by the way, with all of these links on it. It'll be linked with this video, so you'll be able to just click on those and find these yourself or add them to your daily digest if you're looking into this stuff. But what I like about this site is that it's very country specific. It talks about number of confirmed as well as probable cases and the number of people who have died from COVID-19. We can see that if you were watching Canada at all, then when this whole pandemic first began, it really kind of took off in 2 places. It took off in BC and in Ontario. And in fact, for a while, BC had the highest number. And then Ontario surpassed us. But as you can see, Quebec has doubled Ontario, and they're putting some stringent guidelines in place to keep people in place to slow the growth of COVID. In addition to the Johns Hopkins US site and worldwide site and the coronavirus site for Canada, the World Health Organization has an excellent site for COVID as well. It's coronavirus disease. It says 2019 because it did kind of start in 2019, even if those of us in North America weren't affected until early 2020. What I love about this site, aside from the fact that it's science-based, it's worldwide. If you look on the right here, they've got basic FAQ, they've got a worldwide travel advice, situation reports for all the major sites of this pandemic, media resources if you're in the media, and they've also got a lovely Mythbusters section here where they're addressing some of the common misperceptions, and we're going to talk about a couple of those in just a few minutes. But this is an excellent resource. One of the things that I really want to tell you about, because I think this is relevant to many people, speaking about myths, when this whole COVID thing began, who knows where it came from, but somewhere out there, this idea was floated that people who took ibuprofen to help themselves with COVID-19 symptoms actually got worse. In fact, there's no evidence to support that. What science says, and as you can see from this alert from the Canadian government, there's no scientific evidence that ibuprofen worsens COVID-19 symptoms. Now, the reason I want you to know this is because some people really struggle with taking acetaminophen or Tylenol. It has some side effects for them, so that can be a concern. Also, along with the toilet paper, people kind of mass bought things like rubbing alcohol and Tylenol because of this misperception. So many of you may have gone to the store to try to get Tylenol products based on this information and weren't able to get any. And what I want you to know is there's probably lots of ibuprofen there because most people are still under this misperception, and you may very well have some Advil or other types of ibuprofen at home. And I want you to know that you can take that. Should you start to experience any symptoms, you don't need to worry about using ibuprofen. There's another site that I want you to know about if you're on Facebook. It's called Coronavirus COVID-19 Scientific Discussion Space. This is a site that was just created by a Facebook friend of mine who lives abroad, not in North America. There's a mass of us, and we're all just sharing and discussing together the science of coronavirus. So there's no woo, nothing questionable, experimental, alternative here. So if you just want to engage in a discussion or just see what kind of is happening around the world from a science base, I think this is a really great source for you. Now, I'm just going to go back for a moment here to our PowerPoint and share a little bit more with you from that, and then we're going to come back to look here. So we saw, let's see here, we looked at the Johns Hopkins link, Government of Canada, World Health Organization, ibuprofen is okay for COVID-19. We looked at the Facebook page, and now I want to talk with you about safe practices when you're getting the essentials for life without getting COVID-19. So what we're talking about here are things like groceries, pet food, gas, takeout. There are some excellent resources online for best practices. One of the ones that a friend on Facebook shared with me is from a doctor in the United States, Dr. Jeffrey Van Wingen. I'm going to show you the YouTube link for his channel. It's very informative, and this is an excellent video that I want you to be able to watch as well. It's about how to tackle getting ready to go shopping, being at the store, bringing your groceries home, and doing everything you can to reduce the risk of exposure to COVID-19 to you or friends or family using sterile technique like they would in the hospital. There's a link to the YouTube, but again, I'm going to take you there in just a minute and show you how to find it online. General guidelines from Dr. Jeffrey Van Wingen are wherever possible, where appropriate, microwave your food a little bit. It doesn't take very long, but apparently the process of microwaving really eradicates the COVID-19 virus. Contradicting some common misperception, freezing does not help. As you can see here, it has been certain strains of coronavirus have been shown to still be alive out of the freezer after 2 years. In other words, if you were to take that bag of frozen blueberries that you just bought and you thought, I don't need to wipe this down, I don't need to practice sterile technique with this because it's going in the freezer, that'll take care of it. No, not unless you're going to leave it in there for more than 2 years apparently, and that's probably not what your plan is. So I want you to remember that just putting something in the freezer does not sterilize it and take care of the coronavirus. Microwave, much better, but I'm going to share Dr. Jeffrey Van Wingen's guidelines here. If you have a shopping service or delivery service coming to your house, you do not want to let that person in your home. I know it's kind of weird right now. There was a Facebook video of two folks in Asia passing each other in a stairwell, and under any other circumstances it would have seemed so odd and extreme, like you would have assumed that these people had obsessive compulsive disorder or something in terms of the distance they were keeping from each other, and yet really it's absolute best practices right now. So don't be concerned with what other people think, just keep yourself and the people you care about safe. So we're not going to let that delivery person into the house. We're going to have them leave the groceries on the porch, outside your door, and then we're going to talk about what to do when you bring them in. It's important to understand that coronavirus can live aerosolized outside the body for 3 hours. That means if somebody like that driver happens to, unbeknownst to them, be infected with COVID-19, or maybe the person who helped pack the groceries just happened to sneeze on your bag, and it took a few hours for that bag to get to your house, that COVID-19 virus is still alive and well on that bag, and you're about to pick it up and touch it and bring it into your home. So we want to keep that in mind. It can live on cardboard for 1 hour. So if that pizza delivery driver has been exposed to COVID-19, do not assume that just because it's takeout or just because it's cardboard, you're fine. That cardboard can carry that coronavirus live for up to an hour. And metal and plastics for 3 days. So those plastic bags, that plastic wrapper, those soup cans, 3 days. So if possible, best practices is leave those groceries in a porch or, covered area, safe area for 3 days. It's not possible with some of the things that we're getting, just in terms of they might be perishable, as well as maybe you, like me, you live in a maybe rural area where there are literally bears and coyotes and all sorts of things. I can't really leave my groceries out. While you're shopping, you want to bring some wipes with you or some spray, antiseptic spray, and you want to make sure you wipe down the cart handles, anything that you're likely to touch that someone else almost certainly did touch. I want you to imagine that the person who used that cart before you had a toddler who has COVID-19 and who touched everything. Sneezed, coughed everywhere, and do your best to make sure that you wipe everything down before you go into the store, before you touch that cart yourself. Also, Dr. Van Wingen suggests that you really think before you touch anything in the store, you commit to buying. So in other words, where we might normally stop and pick something up, look at the ingredients or the label, maybe caloric or fat content if you're watching these things. If you're diabetic, you might naturally look at the carbohydrate or sugar content. We're not going to be doing that now. We're going to have a sense of what we need to get, and before we touch anything, we're going to know that that's what we want. So we're just going to touch it once, pop it in our cart. If you have any respiratory symptoms, if there's any question in your mind, as much as you might very much like to believe that you're okay, err on the side of caution and don't go. Order delivery service, get someone to do these things for you. Really, for best practices, for everybody's sake, stay away. Anybody over the age of 60 ideally is not heading out right now either, because you're in that risk zone. I know sometimes you might need to go, you might be over 60 and you might be on your own. So that's even more important that you take all of these precautions that we're talking about today. When you go, think 2 weeks. You want to really minimize your exposure to the outside world for this next little while. So think, I want to get 2 weeks worth of groceries as best I can. Plan ahead to what you're going to buy so that you really minimize your time in the store. And as discussed, you want to only touch those things that you're going to take home. If you can, call ahead and have the store prepare things for you. So many grocery stores are inundated with these requests. So if it's groceries you're hoping to have delivered, you might have to be really patient. Definitely plan well ahead, like perhaps even a week ahead with your grocery store for your order to come here. You're going to order it here. Pet stores and pharmacies are a little more accessible, and they're more than happy to have you call ahead, prep your order, so all they have to do is pass it to you. When you get home, you want to follow sterile technique protocol. So what that means is before you even bring your groceries in the house, you've created some space on your counter with a workspace, and you've used a standard disinfectant on the whole space. Now what you're going to do is you're going to split your counter in half, and you're going to put the groceries that you've just brought in on one side, and you're going to leave the other half clear for once you've sanitized these to put that on. So there's going to be a nice sense of separation between these two. You're going to actively disinfect the outside of all packaging. You're going to use wipes or spray, depends on the product. Meaning if it's something that's got a cardboard wrapper or the type of wrapping that it is, the type of product that it is, a wipe might be more appropriate than a spray. But you, again, remember what I told you about the freezer. So the fridge is not a place where COVID-19 is going to die quickly if it can live for 2 years in the freezer. Wherever possible, remove the external packaging. So for example, if you brought a box of cereal home, you can take the plastic sealed bag out of the cardboard bag, put the cardboard in the garbage, and put the plastic packaging on this nice clean side of the cupboard for now, or the counter for now. Where possible, use alternative storage containers. So let's say you just brought a loaf of bread home. You're going to pop the bread out of the plastic bag into a Tupperware or some other storage container. That plastic bag that just came home from the store that could have been touched by a worker or another shopper who has been infected with COVID-19 without knowing it is now going to go into your garbage, and your bread is COVID-free. Fruits, oranges, apples, vegetables should be soaked in soapy water before you put them away. Each piece of fruit can be washed for 20 seconds, just like you would wash your hands, and that's going to help you to know you've done your best to avoid bringing COVID-19 into your home. If you use cloth bags, and many supermarkets have already gone to the point where they don't have plastic bags for you to use, and good for you if you do use cloth bags, but I want you to assume that they are infected and leave them outside for 3 days or more. If you're only going shopping every 2 weeks, that's okay. Leave them outside for 3 days or more, then throw them in the washing machine. Do not assume that they're fine. Assume they are not. When it comes to takeout, we want to do essentially the same practice. Sanitize your countertops, separate the space in half, have the space for the stuff that just came in, and have a plate or a bowl as appropriate on this other side of the counter. And you're going to take everything out of the takeout containers without touching the takeout containers to your plate or bowl. You're going to put the food in there. Same thing with sauces like ketchup packs. You can squeeze the ketchup or the sauce onto the plate. Don't touch the packaging to your plate. Put it back in the bag in which it came. Dispose of all that packaging. Put it outside. Leave it for at least 3 days before you touch it again. Once you've done all that, you're going to wash your hands with soap again for 20 seconds, and then you can relax. It takes probably an extra 10 or 15 minutes if you've done a sizable grocery shop. I have a family of 4. So there's usually quite a lot of groceries coming in. So 10 to 15 minutes do a really good job of this sterile technique that we just talked about. But then you've got peace of mind. You know that whatever you're eating, whatever you've just brought into your house is not going to harm you or your family. If any part of you is thinking that this is overkill, there's an excellent episode of Mythbusters. What I'm going to do right now is just take you to YouTube. And I'm going to show you, let's see here. Let's back up the bus here a little bit. Here's Dr. Van Wingen. Let's just let him introduce himself.
Help you shop safer. Rapids, Michigan, with 20 years experience. The point of this video is to help you shop safer and get takeout food safer during the stay-at-home shutdown due to the coronavirus pandemic. Today,
yes. So you'll see here in your window, just enter Jeffrey Van Wingen into the search, and you'll see he's got a wonderful video, PSA Safe Grocery Shopping, and he really walks you through. You can see he's got that tape down the center of his counter. He's really serious about this sterile technique and does a really good job of educating you on why it's important and how to do it. Mythbusters made a video in 2015, actually, that's really relevant today about how germs spread. If you just enter into your search bar on YouTube, Mythbusters germs spreading, you'll see that video. It's about 5 minutes long. They're closer to 6, and they're going to take you through really something very interesting. Let me just go back here for you. What they did with this Mythbusters episode is they simulated a situation where one of their cast members had a cold virus, and they sat for 30 minutes with 5 other people playing a game and just having a drink around a table. A few of the guests knew that there were germs present and they were trying to avoid them, and others were not told, and so they acted quite normally. After all of this happened, they were all tested with an ultraviolet light to see who had attracted how much virus and where. What they actually turned up was really quite remarkable, that even those who were legitimate germaphobes and knew what to look out for and trying to be really careful ended up, for the most part, with some of that virus on them. Some much more than others, for sure. But the point is that even when we're trying to be mindful, we're talking about microscopic things here, and they really are easily spread, as we're seeing here. Sorry, hang on a second. Okay, so I think that's all the stuff I wanted to cover with you. Let me just go back here. So what we've talked about, hang on. So we've talked about social distancing and the importance of that. We've talked about ibuprofen is okay. Don't perpetuate the myth that it isn't. Educate yourself. And if that's your pain reliever of choice, know that there's no consequences from a COVID-19 perspective of using ibuprofen over acetaminophen. I showed you the Johns Hopkins website, the Canada website, and the WHO, World Health Organization websites that are great resources for you keeping track of what's happening around the world and what good medical science sites are telling you about best practices. Then we looked at Dr. Jeffrey Van Wingen's best practices for sterile technique, for getting takeout and for bringing things in. And we talked a bit about the statistics of how COVID is transferred and how long it can last on certain foods. And lastly, we talked just now about the Mythbusters episode that just visually kind of gross, but really helpful for you to just understand that it doesn't matter how smart you are, it doesn't matter how careful you are, viruses spread so easily. And that's really what we're seeing, especially with that John Hopkins video, the map of the world, and seeing how quickly this thing really just came about, mostly in the last month for the majority of the world. So I want to thank you very much for taking the time to be with me here today. My name is Michelle Morand. You can access me through Cancer Treatment Options and Management, that's ctoam.com website, or post a comment on YouTube or on Facebook. And let me know if you have any other questions, because I'll be making some more videos and making sure that you have all the information that you need to stay safe. We're going to keep busting those myths and making sure that the information that you're receiving and that you're sharing with others is as accurate as possible, so we can all get through this as quickly as possible. It's definitely strange times out there, but keep your head up. Take care.
Thank you for watching Cetome TV. Subscribe below and stay informed.